Welcome to our presentation on Patricia Benner's Skill Acquisition in Nursing Theory. This is presented by Nicole, Robyn, Jenna, and Jason. Enjoy! We will be covering a variety of topics during this presentation, starting with some brief history of Patricia Benner's life and career, moving into the description of the theory and its basic concepts, how the theory has been applied in other researchers' work, and ending with an example of how to apply the theory in a case study.
Born in 1942, Patricia Sawyer Benner grew up in Ontario, California with two sisters. Her interest in nursing began when she worked as an admitting clerk at a local hospital while attending Pasadena City College. She continued her education by pursuing her master's degree in nursing in 1970 and doctorate in 1982 from Berkeley. Dr. Benner married in 1967 and has two children. She's an accomplished professor at the University of California, San Francisco, with 9 published books to date and several journal articles. Benner acknowledges many different academics that have influenced her work, such as Hubert Dreyfus, Stuart Dreyfus, and Virginia Henderson. The model of skill acquisition is composed of 5 stages: novice, advanced beginner, competent, proficient, and expert. Nurses advance to the next stages in a variety of methods. This is a shift in nursing theory, which typically uses rhetorical knowledge as a foundation of practice, to using past practice experience as our new framework. Learners' perceptions of the situation change, leading to increased ability to pick out pertinent information and use it to build a holistic clinical picture, thus emphasizing the importance of actively engaging during their practice rather than being a detached observer. The novice stage is the first in the theory and is comprised of beginners, typically nursing students in undergraduate programs. These are learners with no previous experience in nursing situations who often rely on theoretical knowledge that typically results in rigid and limited clinical behaviors. Next is the advanced beginner stage, where most newly graduated nursings belong. These learners have some real-world experience in nursing practice that has increased their ability to notice recurring and meaningful patterns. They also possess knowledge and skills that allow them to apply rules of practice with safe flexibility, but lack true in-depth experience. Benner identifies stage 3 as competent, which contains nurses that are able to see the long-term effects of their interventions and nursing actions. Despite having increased abilities to interpret clinical situations quickly and increased accuracy and organization, they lack the efficiency and adaptability seen in proficient nurses. Proficient nurses encompass stage 4 and rely on their clinical experience to predict outcomes and modify interventions to ensure desired outcomes. These learners are able to see the full clinical picture, notice pertinent details quickly, and intervene when necessary. Lastly, there is the expert stage. These nurses use their intuition, past clinical experiences, rules, and guidelines to quickly understand necessary actions to take. Benner has also included the concept of caring in her skill acquisition theory regarding nursing practice. Benner defines caring as being connected and having things matter with fused thoughts, feeling, and action. It is important in nursing practice because it creates connection and concern in the nurse for the client and nurtures an environment that enables nurses to provide assistance to their client. Caring is characterized by empathy, support, compassion, protection, and nurturance.
There are several different applications of Benner's theory of skill acquisition in nursing research. A study conducted in Halifax, Nova Scotia, investigating queer women and their primary healthcare providers utilized Benner's theory. The researchers concluded that in agreement with Benner, cultural competence skills for providers when caring for members in the LGBTQ+ community should be considered a clinical skill that must be practiced rather than a skill learned purely through classroom theory. Another study that utilized Benner's theory was conducted in Denmark and focused on the guided self-determination method in performing person-centered care. The purpose of this method is to support patients' development of life skills, and Benner's model was used to expand the focus on transition between skill levels.
Here is a case study following the model of skill acquisition in nursing. So for patient background, we have Miss R, who is a 70-year-old female admitted to the med-surg unit with pneumonia. She has a history of hypertension, diabetes, and chronic obstructive pulmonary disease. Miss R is married, and her husband is her primary caregiver. She has 2 adult children who live out of state. Her husband has expressed concerns about caring for her at home as her health has been declining for the past few months. On admission, Lily, a newly graduated nurse, assessed Miss R's vital signs, oxygen saturation level, lung sounds, and mental status. Lily's education in assessment techniques and pathophysiology allowed her to recognize that Miss R had difficulty breathing and was using accessory muscles to breathe. Lily also used her knowledge of effective communication techniques to build rapport with Miss R and ask her about her concerns. Miss R is diagnosed with pneumonia and underlying COPD. With this knowledge, Lily uses her nursing education to administer the prescribed medications and treatments. She then monitors Miss R's vital signs and encourages her to take deep breaths and cough regularly, just like she practiced in school. Lily also provides emotional support to Miss R and her family, explaining the treatment plan and how providing reassurance that Miss R was receiving the best possible care. Lily's education in patient-centered care and communication skills allowed her to involve Miss R's husband in the care process, and she teaches him how to assist with these deep breathing exercises. Next, Lily evaluates Miss R's response to treatment. This includes her improved oxygen saturation levels and lung sounds, as well as decreased respiratory distress. Lily utilizes suggestions from her mentors and senior nursing staff to get the most accurate data collection, and she uses their feedback to help direct the care. Lily's education in data analysis and clinical decision-making helped her to interpret these assessment data and modify the plan of care as needed. Lily was able to seek advice and guidance from other more senior nurses on the unit to make sure that the most effective and beneficial care for Miss R is present. Miss R expresses gratitude for Lily's care and support, and her husband feels more confident in his ability to care for her at home, thanks to the skills that Lily has taught him. Throughout all of this, Lily's personal experience as a caregiver to her grandmother, who is diagnosed with COPD, has helped her empathize with Miss R's situation and provide emotional support not only to Miss R, but also to her husband. Thus, she is utilizing Patricia Berner's model of skill acquisition. Lily was able to relate to the challenges faced by the caregivers, as well as the anxiety and stress experienced by the patients and their families. This allowed her to provide a high level of compassionate care, demonstrating the importance of empathy and nursing.
Thank you for watching, and here are our references used throughout this presentation.